Right, now we're stepping down into 4 stocks, which are all market capitalization of like 2 billion and below,
Yeah.
0 profits, 0 dividends.
Correct.
All focused on their pipelines. So GW Pharma is Cambridge based, that's the United Kingdom, but it has a Nasdaq listing under the code GWPH. It is focused pretty much exclusively on taking marijuana and the vegetable-based drug, that is, and extracting from that products which are used, and the 2 things that they've got, the one is called sativa, which will sound familiar, and the other one is called
Epidiolex.
Epidiolex.
Correct.
Okay, and this is going to be used obviously in everything to do with pain, nausea, and also epilepsy. This is another area where apparently central nervous system epilepsy, is reduced, and the likelihood of fits is reduced.
Correct.
If you take this stuff. So tell me about this, how this one looks to you.
So look, I mean, here is a cannabis play, plant-derived production on it. I think what we've got to understand about medicinal marijuana is that it's oftentimes a substitute, and a very effective substitute compared to the traditional prescriptions we have.
Yeah.
So in fact, research is starting to show that these drugs are more effective in, as you said, the epilepsies, the glaucomas, the multiple sclerosis, in that regard. But they're not mainstream as much as maybe these companies would like.
Yeah.
Growing revenues. This was a company who developed the world's first prescription medicine from cannabis. That was this Sativex that you mentioned. It hasn't had a good run on the market, so it's had 3 years of pretty much no movement in that regard. But their pipeline, that approval pipeline we spoke about, is looking very promising.
Yeah.
Medicines are starting to reach the later stages.
Let's look at the share chart, because it worries me a little bit that, so it does look a little bit all over the show. Why would the plant-based be the way to go? Because that sounds to me like then there's less barriers to competitive activity.
Sure.
And what about registration? Because has the registration been fully approved? Because Sativex sounds a little bit like something you would get at the front of the discount.
Yes.
Now, it's not really a medicine.
Yes.
This is a sort of a herb-based extracts company masquerading as a pharma company.
Yeah.
Or am I
No.
being unfair?
It's got approval in almost 30 countries globally.
Sativex does.
Correct.
As a low-end kind of a thing. And how do you take it? Do you
So this
orally?
one, as far as I know, is oral.
Yeah.
There's some others that are on the touch. But yes, I mean, I think you spoke, the farming of this as plant-derived is cheaper than having to artificially make in that regard. And the problem with this industry is it's very fragmented. So, the people who are setting up farmings, it's kind of mom and pop shops. Even the distribution is not overly
like, for
large.
example, would I be correct in understanding that in certain states of America where marijuana has been legalized, that means that people who take the marijuana essence, the oil out of the herbs, can actually put it into a cream, which gets sold to people who've got terrible lower back pain or that sort of thing.
Yes.
Those are popular products that are widely used already.
Correct. So what you're seeing is more regulation following that increased kind of informal production in that regard. These guys are obviously highly regulated, and they're providing that product.
Yeah. Okay, and as far as that goes, then we would have to say that this has potentially got substantial application, because people are already using the product. We know that. People who have, chemotherapy and are suffering from nausea, people who've got acute pain in one place or another will already be using these products, and this is an opportunity for them to get that, but without having to do the smoking, because smoking is terrible for you.
Correct.
So if you've got another way of getting the THC in without the benefit of the smelly smoking going on, then that's a massive plus.
And with regulation comes a standardization of product, more health and safety regulations around it. So for users, it's good, and there are a lot of users.
Okay, so what are you going to go, hot or not on this one?
I like this one. I think it's biggish out of the others we're chatting about, $2.8 billion. Plant derived. I think it's a good low cost input, so I like it.
I'm going to go not hot on this one. I did check with a research-based farmer friend of mine who's based in Wisconsin, and his comment was that he much preferred Zonoba, which was a company we're going to talk about later, which is synthetic manufacture, and that in his view he was a little bit concerned that GW was more of a kind of a crossover. So I'm going to go not hot on the basis of that recommendation, but I like your thinking anyway.